Hola, muy buenos días y gracias por conectarse a esta sesión informativa de la Organización Panamericana de la Salud sobre la pandemia por COVID-19 en la región de las Américas. Soy Sebastián Oliel del Departamento de Comunicación de la OPS y esta sesión, como todas las semanas, durará alrededor de una hora. Ya hemos recibido preguntas suyas por correo electrónico y también podrán hacer preguntas en vivo y a través del chat mediante el botón Q y A. Recuerden siempre, por favor, incluirnos su nombre y el medio de comunicación al enviarnos sus preguntas. También les recuerdo que contamos con interpretación simultánea al inglés, al portugués y al francés, y que pueden optar por cualquiera de ellas dando clic en el botón Interpretation. Hoy la directora de la OPS, la doctora Carissa Etienne, les informará sobre la evolución de la pandemia en la región de las Américas, sobre la vacunación y también acerca de la aceptación de las vacunas en nuestra región. Acompañan a la doctora Etienne en la sesión de hoy el doctor Jarbas Barbosa, subdirector de la OPS, el doctor Ciro Ugarte, director de emergencias en salud en la OPS, y el doctor Silvana Aldigueri, gerente de incidente para COVID-19 en la OPS. Ahora sí, entonces quisiera invitar a la doctora Etienne a que nos comparta sus palabras de inicio de esta sesión. Doctora Etienne.
Thank you, Sebastian, and a very good morning to you. And thanks for joining today's press briefing. Last week, there were over 1.1 million new COVID-19 cases and 31,000 new deaths reported in the Americas. And for the last few weeks, 4 of the 5 countries with the highest weekly death counts in the world continue to be here in our own region. Mexico has reported a slight uptick in cases, driven mostly by both the Baja California region and the Yucatan region over the past 2 weeks, while COVID-19 cases and hospitalizations are slowing in the US and Canada. Cuba and the Dominican Republic continue to drive most new cases in the Caribbean, while Trinidad and Tobago is still reporting high death rates. In Central America, infections over the past 2 weeks are on the rise in parts of Belize, while case incidence in Guatemala and Panama has risen over the past week. Costa Rica and Honduras are starting to see a decline in cases. Further south, recent surges in COVID infections are filling hospitals in Bolivia, Chile, and Uruguay, mostly with younger patients between 25 and 40 years of age. In the Brazilian city of Sao Paulo, 80% of the ICU beds are occupied by COVID patients. And Colombia's COVID situation is now at its highest point nationally, with very high occupancy of ICU beds in large metropolitan cities. Against this backdrop, we urge countries to tighten public health measures in places with high transmission. This is the most effective way to bring cases down until we have enough vaccines for everyone. Over the weekend, leaders from the Group of 7 pledged 1 billion COVID vaccine doses for countries in need around the world. This promise brings fresh confidence that we will overcome the supply barriers that have prevented many nations and territories in our region from getting the doses that they need to protect their populations. Today, less than 1 in 10 people in Latin America and the Caribbean have been fully vaccinated against COVID. Yet, we are a region of more than 600 million people where cases are mounting, hospitals are full, and variants are rapidly circulating. So while vaccines are needed everywhere, we hope that the G7 nations will prioritize doses for countries at greatest risk, especially those in Latin America that have not yet had access to enough vaccines to even protect the most vulnerable. These doses cannot come soon enough, so we urge G7 countries not to delay their donations. We need the vaccines now. Across the Americas, while COVID vaccines have been slow to arrive, uptake has not. Just this past weekend, over 140,000 people were vaccinated in the Brazilian city of Manaus. And throughout Latin America and the Caribbean, people are eager for a chance to get vaccinated. So it's easy to see why, because vaccines work. More than 2 billion COVID doses have been administered around the world. In places where COVID vaccination coverage has been high, like some United States, the United Kingdom, and Israel, there has been a dramatic reduction in COVID-related hospitalizations and deaths. When outbreaks occur, as Chile is experiencing now, COVID vaccines are protecting those who are vaccinated, including health workers, from the worst of the virus. And this is exactly what COVID vaccines were designed to do, to protect our communities and to help us save lives. With the prospect of additional doses, we want to remind countries about the importance of communication campaigns to maintain trust in vaccines. Having clear and transparent information about when doses are or aren't available, and consistent guidance on who is eligible for vaccination is key to increasing confidence in our vaccination programs. It is when there are breakdowns in information and communication, or when details are slow to arrive, that misinformation can take root. The World Health Organization and PAHO have issued updated guidelines for countries making and adjusting their COVID vaccination campaigns as additional doses are made available. When these new doses arrive, we also want to remind countries that prioritizing vaccines for those most vulnerable, like the elderly, our frontline workers, and those living with pre-existing conditions, that this is key to protecting hospitals and saving more lives. Health workers should receive special attention, as they're not just at greater risk of contracting the virus, but they are also some of the most trusted voices for vaccines. People naturally turn to health workers, including doctors, nurses, and community health workers for medical advice. So we must ensure that our health workers have the information that they need to answer their communities and their own families' questions. And finally, I want to remind citizens that the vaccines authorized by WHO and delivered through COVAX have been thoroughly assessed by experts. So when it is your turn to get vaccinated, embrace what's available to you and don't delay your vaccination. Getting vaccinated as soon as you're eligible is the best way to protect yourself and your community. This also means that if your vaccine requires 2 doses, you should get your second dose when it is scheduled to ensure that you have the best possible protection. I want to be clear that the primary issue in the Americas is vaccine access and not vaccine acceptance. Across Latin America and the Caribbean, we have a long legacy in immunization and trust in the life-saving power of vaccines. Once new doses are available, countries are ready to distribute them as quickly as they arrive. And PAHO will work tirelessly to get vaccines to every corner in our region until this pandemic is behind us. We are counting on our leaders and the support of the global community to ensure that the Americas have the doses that they need as soon as possible to save lives.
Muchas gracias, doctora Etienne. Vamos a pasar ahora a responder las preguntas que ya nos han enviado por correo electrónico y que también nos están enviando a través del QIA. Recuerden, al enviarnos nuevas preguntas, por favor, incluir su nombre y medio de comunicación. La primera pregunta que nos llegó de Ernesto Londoño del New York Times en inglés dice: In Brazil, healthcare workers have expressed concern over the number of people who appear to be skipping their second dose appointment. Is this a phenomenon PAHO is watching? Does it appear to be widespread in the region among populations that are eligible for vaccines? Doctora Etienne.
So, thank you, Ernesto of the New York Times, for your question. So we have had reports that this is happening in some countries. And while the data is still limited, we really don't think that it is a widespread phenomenon. But even so, this should not happen. We need to use all means possible to ensure that people are fully vaccinated when their turn comes. There is strong data showing that vaccines with 2-dose regimens, like the ones that are in use in our region, offer their best protection when both doses are delivered within schedule. People that have completed their vaccination cycles are significantly better protected from severe COVID and also the risk of death. This is true even with the new variants that are circulating. Each one of us should really take the responsibility for protecting ourselves and for making sure that we show up for our second dose appointment. This is not just a matter of personal commitment. It is also a matter of public health. We know that vaccines work best when many of us are fully immunized. And this helps prevent illness and death and eventually the spread of disease. So that's why it's really crucially important for immunization programs throughout our region to set up the systems that are required for helping people get their second dose as planned. And in this, healthcare workers at the primary healthcare level have an important key role to play in following up with community members through whatever means possible. When people or where people don't come for their vaccines, the health systems must go to the people with classic community outreach, offering immunization where they are, whether they are in remote villages or in urban slums. This is the primary healthcare way of reaching those that are not yet reached. With so much inequity, we need to make sure and we need to ensure that most of the vaccines that we have at hand are used. We need to make the most of them. Stopping the pandemic for good will require that we not only have access to the vaccine, but we administer them widely, covering 70, 80, 75% of our population. Thank you.
Gracias, doctora Etienne. La siguiente pregunta es de David Zapata del diario La Prensa en Honduras y dice: ¿cuál es la opinión de la OPS sobre cómo avanza la vacunación contra COVID-19 en Latinoamérica, específicamente en Honduras? Dice que es uno de los países de la región centroamericana con menos vacunas aplicadas. Doctor Barbosa.
Gracias por la pregunta, David. Nossa diretora ha subrayado em todas as conferências de prensa que consideramos que a América Latina necessita de muito mais vacunas do que tem acesso nesse momento. É uma realidade que a América Latina e o Caribe siguen como um dos epicentros com altas taxas de mortalidade em muitos países e o acesso todavia é muito limitado. por muchas razones que todos conocen, el acaparamiento de vacunas por los países desarrollados desde el principio. Así que tenemos una situación donde sí se necesita de más vacunas para que la región pueda proteger los más vulnerables y también alcanzar una cobertura de vacunación que sea capaz de controlar la transmisión. Hay algunos países en América Latina que, utilizando muchas alternativas, como las vacunas por el mecanismo COVAX, los acuerdos bilaterales y otros, están ya avanzando bastante en la vacunación, como por ejemplo a Chile y a Uruguay, pero en la gran mayoría de los países de nuestra región, la vacunación sigue sigue mucho más despacio do que sería necesario. Estamos siempre subrayando este tema porque la región necesita efectivamente de más vacunas. En el caso de Honduras, Honduras ha recibido por medio del mecanismo COVAX 238.000 doses, mas outras doses estão já para as próximas semanas, pero sem dúvida, são doses de vacunas suficientes para a proteção de los profissionais de saúde, pero todavia não são suficientes para que se pueda proteger a todos os grupos vulneráveis. Por isso, temos que sempre buscar novas alternativas, donações de los países, como Estados Unidos está haciendo, como Espanha já ha anunciado que vai ser, como os países do Grupo G7 ha anunciado, para que se pueda ter acesso mais equitativo a las vacunas no mundo e particularmente na região de América Latina e do Caribe. Muchas gracias.
Gracias, doctor. Me gustaría pasar a Melina Ochoa de Uno TV Noticias en México para que haga su pregunta. Melina, si nos estás escuchando, adelante.
Hola, muy buenos días. ¿Me escuchan?
Sí, sí.
Muy buenos días, Melina Ochoa, reportera de Uno TV Noticias en la Ciudad de México. Preguntar, ¿qué opina la OPS sobre este rebrote que ya comentaba la directora que vive en México, en específico 6 entidades federativas, Baja California Sur, Campeche, Sinaloa, Veracruz, Tamaulipas, Quintana Roo y Yucatán, anunciadas por el subsecretario Hugo López-Gatell? Y bueno, si es necesario relanzar acciones o un programa nuevo para evitar incremento de casos y defunciones en el país mexicano, dado que pues la gente se ha saturado de información y está quitando interés a esta situación de la pandemia. ¿Cuál sería su opinión? Muchas gracias.
Gracias, Melina. Doctor Aldiguieri, ¿podría contestar?
Sí, gracias, Melina. Yo había compartido algunas consideraciones sobre la evolución de la situación en México durante la conferencia de prensa de la semana pasada. Sin embargo, con mucho gusto puedo dar una actualización. México notifica a la OPS de manera regular, diaria, bajo el Reglamento Sanitario Internacional y publica tablas actualizadas sobre su situación, incluyendo un semáforo que permite tener una fotografía precisa de las tendencias en las 32 entidades federales. Si bien las tendencias siguen en una meseta en la mayoría de los estados, como usted lo dijo, 6 estados reportan un incremento de sus tendencias. Y de esos 6 estados, 4 estados se encuentran en la clase naranja del semáforo, con toda la evidencia: Baja California del Sur, Tabasco, Quintana Roo y Yucatán. Por supuesto, la situación en esos estados más turísticos, tales como en la península del Yucatán o el istmo de Baja California, necesitan una evaluación muy precisa, dado sus conexiones nacionales e internacionales. En este contexto hemos sido informados por las autoridades sanitarias federales de contactos estrechos con los estados mencionados, reactivando las medidas preventivas y promoviendo activamente la vacunación. Pero un nuevo programa en este contexto no, se recomienda aplicar el plan existente, que tiene varios pilares, con hincapié en los aspectos siguientes: la promoción y la aplicación estricta de las medidas de prevención no farmacológicas, también llamadas medidas de salud pública, en la aceleración de la vacunación para cubrir un máximo de personas, un fortalecimiento de la vigilancia de las variantes circulando en México, variantes del virus SARS-CoV-2, y caracterizar esos brotes con las herramientas disponibles que existen en México, incluyendo la secuenciación del virus. Y utilizar el instrumento de investigación de brotes y rastreo de contactos. GoData es un instrumento desarrollado por la OMS, pero que ha sido adoptado desde el año pasado por las autoridades federales y el Instituto Nacional de Salud. Realmente es, repitiendo, implementar de manera fortalecida el plan existente con hincapié en esos 4 aspectos que acabo de mencionar. Espero haber respondido a su pregunta. Gracias.
Gracias, doctor. Tenemos preguntas relacionadas con el inicio del invierno en pocos días en el sur de la región y también el inicio de la temporada de huracanes en el Caribe. Y la pregunta es, ¿cómo tienen que prepararse los países y qué puede hacerse para evitar brotes o aumentos de casos en estos 2 contextos de climas diferentes, doctor Ugarte?
Gracias, Sebastián. Gracias por la pregunta. Este es un tema de alta prioridad para los países que son afectados por huracanes, pero también por inviernos severos. La OPS ha organizado una serie de reuniones con las autoridades nacionales, con organismos internacionales y con expertos sobre cómo enfrentar una temporada de huracanes, pero también cómo enfrentar temporadas de invierno en el contexto de la COVID-19. Hemos sido testigos de la devastación que ocasionaron los huracanes, particularmente en Centroamérica el año pasado, donde alrededor de 10 millones de personas fueron afectadas directamente por estos huracanes y donde hubo un daño a los servicios de salud, que por supuesto tuvieron impacto también en el incremento de casos de la COVID, porque muchas personas tuvieron que ir a albergues temporales donde las condiciones eran favorables para la transmisión del virus. En este caso es muy importante asegurar que los servicios de salud continúen operacionales en todo momento. En particular, cuando hablamos de servicios de salud nos referimos a los puestos, los centros de salud, los hospitales, pero también los sistemas de diagnóstico, es decir, los laboratorios, otros tipos de servicios que proveen programas de salud pública, asegurar que existan camas, por ejemplo, de hospitalización, de cuidados intensivos, y que los centros o lugares donde las personas tienen que estar en cuarentena o en aislamiento estén protegidas y estén funcionales. Necesario también asegurar que las personas tengan acceso al servicio de salud, es decir, que el personal de salud esté disponible y listo para poderse movilizar en caso de urgencia a la zona que sea más afectada. Y quisiera resaltar algunos puntos muy importantes respecto a la COVID-19 en el contexto del invierno y la temporada de huracanes. Se ha demostrado que las medidas que se implementaron desde el inicio de la pandemia siguen siendo válidas y en contextos de eventos extremos aún más. Es decir, la detección temprana de los casos, la identificación de los casos clínicos, de los casos sospechosos, el aislamiento de los casos sospechosos, la cuarentena de los contactos y también, por supuesto, el tratamiento oportuno de esos casos. Con esto vamos a poder continuar la seguridad y poder controlar la epidemia, mientras que la vacunación llega a los niveles de protección de la población. Los eventos, el invierno tiene situaciones propicias para que las personas estén mucho más tiempo dentro de espacios cerrados, de tal manera que la posibilidad de transmisión es alta, y estos procesos que acabo de mencionar tienen que ser fortalecidos en todos los niveles. Gracias.
Muchas gracias, doctor Ugarte. Vamos a pasar a la siguiente pregunta de Emilia Wexler, de Clarín, en Argentina. Varias preguntas. Dice, ¿cuál es la posición de la OPS respecto al uso de AstraZeneca en menores de 45 años? Y si la OPS ratifica que AstraZeneca se tiene que aplicar a todo el mundo, más allá de la edad y el sexo. Y también quiere saber si hubo algún avance en este cambio de criterio que pidió OPS para que las vacunas a través de COVAX se distribuyan en cada país por riesgo epidemiológico. Doctor Barbosa.
Gracias por las preguntas, Emília. Mira, la OPS, nosotros seguimos las recomendaciones del grupo de expertos de la OMS para vacunas, que es SAGE, por su acrónimo en inglés, y también de nuestro TAG, que es el Grupo Técnico Asesor para Vacunas de la OPS. Estos son grupos que tienen expertos de toda parte, personas con muchos años de experiencia y de conocimiento sobre el uso de la vacuna, su seguridad, su eficacia, y ese grupo hace las recomendaciones para el uso de la vacuna. Hasta el momento, el grupo SAGE de la OMS sigue manteniendo la misma recomendación sobre las vacunas de AstraZeneca, que son vacunas que se pueden utilizar para todos los mayores de 18 años. Hay incluso datos muy importantes sobre la efetividad de la vacuna de AstraZeneca, que fueron divulgados por la Autoridade de Saúde Pública do Reino Unido, que demonstra uma alta efetividade da vacuna de AstraZeneca para proteger a los casos de COVID, a los casos graves e a las hospitalizações e las muertes. Assim que seguro que cada país hace suas próprias decisões, pero nosotros, com base em las análises que ha hecho SAGE, com base em las evidências que se estão demonstrando hasta el momento, seguimos com a mesma recomendação de uso da vacuna para todos os maiores de 18 anos. La exceção são as mulheres embarazadas, onde para as vacunas que não há autorização para uso em mulheres embarazadas, tem que fazer uma avaliação de risco e de benefício. Ou seja, se é uma pessoa embaraçada que trabalha em uma unidade de terapia intensiva ou em um hospital com pacientes de COVID-19, está bajo um risco elevado se há uma avaliação para administrar a vacuna. Sobre o debate, é um debate aberto, todavia, é muito importante que a região puedan participar nesse debate, porque são parte da governança de COVAX. Vamos atender uma reunião em julho do Conselho, e nós cremos que seria importante ter, sem dúvida, alguns critérios sobre a epidemia, começar a situação epidemiológica, de maneira que todos os países possam receber a proporção que estão comprometidos com COVAX até o final de ano, até 2022, ou seja, os que solicitaram 10% ou 20% vão receber todos os 20%, pero que a fila de entregas se poderia ter algum critério para que os países com maior risco pudessem receber ao princípio. Esse é um debate importante e é necessário se alcançar um consenso entre os países, entre os que coordenam o mecanismo COVAX, que é Gavi, que é a OMS, para que se pueda ter de uma maneira muito bem coordenada com todos os países critérios que puedan perfeccionar o processo de entrega de las vacunas. Gracias.
Muchas gracias, doctor. La próxima pregunta es de Jean Silvano, de Voice of America, en inglés. Varias preguntas. Dice, how is PAHO assisting Haiti in his country's effort to save a surge of the number of new infection of cases? Haiti is expecting to receive soon a shipment of vaccines. Is PAHO part of that international sharing operation? If yes, will that type of assistance continue in the future? And also, is the PAHO office in Port-au-Prince participating in an awareness campaign to motivate the population about the danger posed by COVID-19 and encourage them to get vaccinated? Doctor Aldiguieri, quizás pueda comenzar, y el doctor Barbosa si quiere complementar estas preguntas.
Yes, thank you, Sebastian. I will start, maybe cover the first point and part of the third point. So PAHO is assisting the national authorities of Haiti for all pillars of the response plan to COVID-19. And as for previous emergencies, we have pre-positioned assets in the national warehouse promise. PAHO has a strong team working in Haiti, providing direct technical assistance to the Ministry of Health, MSPP, but is also working with other national partners as the Centre Gesquio, Zami La Santé, and others, and closely coordinating with international partners as the US CDC, and also through the Global Outbreak Alert and Response Network called the GO. So on these pillars of the response, I'd like to highlight a couple of them. And of course, this will be complemented by my colleagues after. First, I'd like to highlight the surveillance systems, including our direct assistance to the Public Health National Laboratory, including for the genomic surveillance. Batches of samples have been processed in PAHO regional reference laboratories, and have identified, for example, the P1 variant in circulating in Haiti, but also working on the expansion of the surveillance in the 10 departments, including with antigen-based rapid tests. But also the second aspect that I'd like to flag is the training and for clinical management of patients, and also for infection prevention and control, including with the deployment of personal protection equipment, again, through the national warehouse. The third point that I'd like to flag is the surge capacity for managing more severe patients. And in this context, we have a couple of emergency medical teams in standby in countries of the region if their assistance is required by the national authorities, depending on the evolution of the situation. And just as an introduction to this bigger topic, of course, PAHO is working closely with the authorities on the preparedness, preparation for the vaccination. This is part of our core activities in Haiti, including the communication for with the public for promoting the vaccination. And on this point, I understand that my colleagues would complement on this. Thank you, Sebastian.
Thank you. Thank you for this question. We are very concerned about Haiti, and trying to support Haiti in many different areas to get the immunization against COVID-19 starting in Haiti. Haiti is the only country in the Americas that is a member of COVAX that hasn't started the vaccination yet, due to several problems, the complex situation in the country. From the beginning, we are supporting the country to prepare all the administrative measures that they need to receive the vaccines. Haiti is one of the 10 AMC-supported countries that we have in Latin America and the Caribbean. So Haiti will receive vaccines free of charge, but they need to adopt the legal, regulatory, and administrative measures. Everything now is ready. The government of Haiti is accepting to receive the AstraZeneca vaccine. So PAHO worked with the COVAX Secretariat to have Haiti as a priority for the new deployment that will start in July, and we will have the date in a couple of weeks to share with the government of Haiti. But we are also working in other areas in other fronts to get the vaccines arriving in Haiti. We are working with the US government that also have Haiti as one of the priority countries to receive the vaccine. We are working on a daily basis with the government of the US to respond all the challenges, the logistics, the administrative measures, legal measures, in order to get the vaccines there as soon as possible. This is very important because, as Sylvain Audiguieri mentioned, the cases in Haiti are increasing, so we probably will face a very important and challenging situation in Haiti, and it's crucial that they adopt the public health measures and at the same time that they get the vaccine to protect the most vulnerable groups in the country. Thank you.
Gracias a ambos. Tenemos algunas preguntas sobre Venezuela. Nicole Shapur de Bloomberg News dice: ¿hasta cuándo tiene Venezuela tiempo para finiquitar el pago a COVAX y entrar dentro de la próxima distribución de vacunas? Y también si puede COVAX empezar a enviar vacunas a Venezuela sin que se haya culminado el pago. Y Mariana Souquet de Efecto Cocuyo también pregunta sobre las variantes en Venezuela y si podemos actualizar sobre la variante C37 en ese país. Doctor Ugarte.
Muchas gracias. Contestaré algunas de las preguntas generales y luego voy a pedir al doctor Barbosa que complemente mis respuestas. Bueno, como sabemos, hay una modalidad de pago que los países que han elegido por una modalidad de elegir qué vacuna reciben, tienen que hacer un pago. Ese pago ha sido procesado en la gran mayoría y hay una cantidad que es necesario continuar el pago. Sobre este tema, yo quisiera resaltar que se están realizando los esfuerzos mayores por todas las vías para que ese pago se concrete y esperamos que se haga lo más pronto posible. De tal manera que eso va a determinar cuántas vacunas puede recibir Venezuela. Y también sobre el tipo de vacuna, etc. Respecto a las variantes, quisiera resaltar que Venezuela ha recibido apoyo de la OPS, tanto del nivel regional como del nivel de la oficina de país, para que tenga la capacidad de detectar las variantes. Este trabajo se ha hecho conjuntamente y se hace conjuntamente con el Instituto Nacional de Higiene y también con el Instituto de Investigaciones Científicas. En ese sentido, el Ministerio de Salud de Venezuela ha compartido información con nosotros sobre los resultados de esta vigilancia y mantiene vínculos de cooperación técnica regulares con el nivel regional y el nivel nacional de la OPS. La información disponible que se cuenta al momento indica que la variante Gamma es la más predominante en todo el país y que se ha detectado la variante Alfa en Apure y Barinas. Ambas son variantes de preocupación. El sistema también tiene capacidad para detectar otras variantes que son variantes de interés, lo cual también indica esa capacidad de detección con el apoyo de los laboratorios de referencia regional, y se han detectado esas variantes de interés en Zulia, Trujillo, y Barinas, perdón. De tal manera que esa vigilancia es muy importante tanto para verificar cuál es la transmisión de la enfermedad y las posibilidades de incremento de la transmisibilidad, pero también para poder controlar cuál es la diseminación y las medidas que se tienen que tomar para controlar esta pandemia. Gracias.
Gracias. Déjeme complementar muy brevemente. Venezuela, al principio no se quedó muy claro si Venezuela iba a seguir con COVAX o no, pero afortunadamente el país ha hecho la decisión de sí seguir con COVAX. Incluso ya está haciendo los pagos que todos los países tienen que hacer, participan de COVAX, los países que son de autofinanciamiento, como Venezuela. Venezuela também ha solicitado a COVAX cambiar o contrato que tem, porque há duas opções para os países de autofinanciamento. Venezuela, al princípio, havia hecho a decisão de tomar um caminho, pero depois solicitou cambiar e nós outros apoiamos o país em las negociações com o secretariado de COVAX para que pueda concluir o cambio de la opción de compra que hace por el mecanismo COVAX. Isso se está concluindo, pero el país, como é um país de autofinanciamento, tem que pagar por las vacunas que vai receber. Então, aguardamos que aí em par de semanas já se pueda, com a conclusão de los aspectos financeiros, poder incluir a Venezuela em las próximas rondas de vacunas que se vão a distribuir por el mecanismo COVAX. Então, isso está pendiente, a conclusão del pago e del cambio de contrato que o país tem com o mecanismo COVAX e esperamos que isso pueda ocorrer com a brevidade necessária. Muchas gracias.
Gracias a ambos. Siguiente pregunta vinculada con el G7 en inglés. What is PAHO's opinion on the G7 statement about the commitment to donate millions of vaccines? Dr. Etienne?
So let me thank you for this question. Of course, we welcome the announcement by the group of 7 who pledged 1 billion COVID vaccine doses for countries around the world. So these donations and the agreements to purchase additional doses for countries in need offers what I think is fresh hope for countries that are struggling to secure enough vaccines to protect their populations, and for the people around the world who are eagerly awaiting protection. But let us be clear that this is also in the best interest of the developed countries themselves, those who have already achieved high vaccination coverage. Today, less than 1 in 10 people in Latin America and the Caribbean have been fully vaccinated against COVID. And what we are saying is that cases are peaking, hospitals are full, and we are already home to the 4 of the 5 highest death rates in the world. So the Americas, we have been in crisis for months. And without the international community's support, recovery remains a distant future. So while vaccines are needed everywhere, we do hope that the G7 nations will prioritize doses for countries at greatest risk, including countries right here in our region. Equitable access to vaccines requires that we prioritize not just the individuals at greatest risk, but also the countries at greatest risk. And certainly I think that this is both the right thing to do, and it is the best strategy to prevent needless deaths and to stop the spread of this virus faster. So this is why we hope that the epidemiology informs which countries are first to receive these donated doses and future COVAX deliveries. I also want to emphasize that timing is key. Vaccines are urgently needed today, so we urge G7 countries not to delay their donations. As we've said before, the Americas are ready to distribute doses as quickly as they arrive, and PAHO stands ready to support our countries. Those countries that are suffering the most should be at the front of the line. And finally, let me be very clear that even with this generous donation, we are still a long way from protecting the more than 600 million people living in Latin America and the Caribbean. Reaching everyone in our region with life-saving COVID vaccines will require the full strength of our collective resources. We need more donations to fill critical gaps in access, and we need them now. We need financial support to secure additional supplies, and we need to increase our region's ability to manufacture vaccines. And we are counting on the support of countries, of donors, and the international community to get us there as quickly as possible.
Thank you, Dr. Etienne. Siguiente pregunta de Julia Simes-Cope de Reuters Colombia. En inglés pregunta, which countries can expect shipments of the J&J Janssen vaccine through the COVAX facility, how many doses they should anticipate, and when those doses will arrive. Also, are any doses of the CanSino single-dose vaccine expected to arrive to the region via COVAX? If so, to which countries, how many doses and when? Y agrego también una pregunta de Manuel Lino González de Los Intangibles en México sobre la vacuna de CanSino, que dice si podríamos aclarar cuál es el estatus de esa vacuna en la evaluación de la OMS. Doctor Barbosa.
Thank you, Julia, and the other colleague for the questions. Let me start with the second one about CanSino vaccine. We have two different processes. A vaccine can be authorized by a national regulatory authority. This is a sovereign decision for each country. The national health regulatory authorities, they assess the dossier that the producers present, showing that they meet all the criteria related to good manufacturing practices, so they have a very good quality process to produce the vaccines, and also the data from the clinical trials, phase 1, 2, and 3, confirming that the vaccine is safe and efficacious. So this is a process that every country makes, it's their decision. The PAHO's revolving fund, that is one of the two procurement mechanisms that purchase vaccines on behalf of COVAX. We use the emergency use listing, EUL, from WHO as the threshold to make the decision what vaccines can be included in the portfolio. Vaccine presenting data to be reviewed by this group from WHO. WHO, to make this assessment, it's not only the WHO staff, but the WHO established technical groups that have participants from the FDA, from the EMA, from other public health authorities in the world. They make an assessment and they make a recommendation. So CanSino is still in the process. We don't know yet when this process will be finalized. It's similar to other vaccines like Sputnik and others. Of course, that we want to have more vaccines in the portfolio, but all the vaccines need to meet the same criteria. They need to be reviewed by the same thorough process that WHO is performing. About the thing, good news that Janssen and Pfizer will start providing vaccine through COVAX. Pfizer has already started with a small amount, but from July on, we will have more vaccines from Janssen and COVAX. Janssen is a very important vaccine to be used in some countries, in some places, because it's a one-dose vaccine. So you don't need one dose to be protected. We are still in negotiation with the Janssen to establish the quantities, the amounts of the volume of doses that this producer will provide through COVAX. We expect to have a small amount of vaccines for the months of July, August, but this will increase for the last part of the third quarter, and in the final quarter of this year, we will have more vaccines. When we will finalize these agreements, we will send to the countries the information about the doses that they are available from AstraZeneca, from Pfizer, from Janssen, and we started the negotiation to establish the date and the flight to send these vaccines to the country. So at this moment, we cannot disclose the countries will receive Janssen because we are still finalizing these agreements with the producer.
Gracias, doctor. Siguientes preguntas de Luke Taylor del British Medical Journal y también Julie Turkewitz del New York Times. Luke Taylor, en inglés las preguntas dice, several South American countries, including Colombia and Argentina, are reporting record COVID-19 deaths. what should these countries be doing to bring down those numbers? Why are they experiencing these surges now while the pandemic is receding in much of the rest of the world? And what does the situation in South America, where the pandemic appears out of control, mean for the pandemic in the rest of the world? Y similar, Julie Turkewitz del New York Times pregunta, what are the reasons that you believe that the virus is so bad in South America and not as bad farther north? Is this just because of the Brazil variant, or are there other factors at play? Dr. Aldigueri?
Thank you, Sebastian. These many questions would allow me to stress some fundamentals of the response to COVID-19 and also to detail the mosaic of the different patterns of transmission that we are observing in the Americas. First, regarding South America, we are talking about countries with large populations that would explain large absolute numbers of new cases and large absolute numbers of deaths. It applies to many countries of South America, not only Colombia and Argentina. The second point, we are talking of countries with large metropolitan areas, I would say megapolis, that trigger closer contacts between citizens during essential and necessary commuting, even when lockdowns are established by the national authorities. And the third point regarding South America is that we can say that during the last year, the virus has established itself in the most remote areas of their territories and can be quickly and strongly amplified in these remote areas and subsequently spread again to areas where control activities were effective at one point, but not maintained. Now, regarding Mexico and Central America, I'd like to remind and recall, as I did, I think one of the first questions in this press conference, Mexico went through an important peak of transmission during the first quarter of 2021. And at this moment, the national authorities are closely monitoring some upticks in 6 states, mostly in the Baja California region and the Yucatan Peninsula. In Central America, we have observed during the last month increasing trends in Costa Rica, and during the last weeks concerning upsurge in Guatemala and Panama. Therefore, we are closely monitoring the situation in this sub-region. It's unclear how the evolution would be. But for both Central America, South America, the Caribbean, and I would say other regions of the world, there are core aspects of the response to bring down the numbers. First, the capacity of the surveillance systems to detect early an upsurge of transmission, including with genomic characterization. Second, triggered by the early detection of an upsurge, the capacity of the national and local governments to implement rapidly strict public health measures and to maintain it according to the trends. And finally, the capacity of the health systems to manage an elevated number of severe patients, ensuring a high standard of care for reducing the mortality. So I'd like to flag that at this moment of the pandemic response, no country, and definitely no region of the world, is protected from new peaks of transmission. The recent example of India is a reminder of that. And the actual upsurge of cases in the UK is another example. No country and no region would be safe until a high vaccination coverage is reached in order to have an impact on the dynamics of the SARS-CoV-2 transmission, and that countries find a right balance between strict implementation of public health measures for lowering down the transmission and economic activities. I hope I have answered the concerns of both journalists and this long list of questions. Thank you.
Gracias, doctor. Tenemos ahora varias preguntas relacionadas con Nicaragua, de Kaylin Romero del Confidencial y también de Lidia López de la Prensa. Quieren saber si la OPS tiene información sobre si Nicaragua ya inició las pruebas para detectar la presencia de variantes en el país y si es así, qué resultados han arrojado. Y también dicen que Nicaragua está dentro de la lista de países que será beneficiado con vacunas Pfizer que donarán los Estados Unidos a través de COVAX, pero Nicaragua no tiene la cadena de frío para almacenar dicha vacuna y preguntan qué alternativa tendría el país ante esa situación, también si es posible recibir la vacuna de Moderna que es compatible con la cadena de frío del país, además de las de Covishield. Doctor Ugarte, ¿podría comenzar?
Claro que sí, muchísimas gracias. La OPS ha proporcionado suministros y herramientas para el tamizaje de variantes de preocupación a muchos países, incluyendo Nicaragua. Y hemos sido informados que el país está finalizando el método y los procedimientos para la selección de las muestras y que en corto plazo ya estará implementada seguramente la vigilancia para detectar las variantes. Por lo tanto, se espera que en las próximas semanas Nicaragua pueda remitir las muestras que sean altamente sospechosas de contener variantes a uno de los 7 laboratorios de referencia que forman parte de la red regional de vigilancia genómica que facilita la OPS. En este sentido, este es uno de los pasos que se construye con la solidaridad de muchos países y que ha logrado detectar variantes en más de 40 países y territorios de las Américas. Gracias.
Gracias, doctor. No sé si el doctor Barbosa quería complementar.
Sí, muy rápido, Lídia, gracias por la pregunta. Mira, nosotros estamos trabajando con el gobierno de Estados Unidos. El gobierno de Estados Unidos ha armado una fuerza-tarefa donde nosotros participamos exatamente para revisar bien de las vacunas que Estados Unidos puede hacer la donación, que son vacunas de Pfizer o de Moderna o de Janssen, qual é a melhor adaptada para a realidade do país. Ou seja, não se vai enviar vacunas que necessitam de uma cadena de frio de ultra correlação para um país que não tenha essa capacidade. Então, isso se vai armar de maneira que se pueda utilizar de la melhor maneira, de la maneira mais rápida e adequada as vacunas, porque não se pode deixar que vacunas que estão que temos em quantidade muito menor que gostaríamos de ter, se podem desperdiçar. Assim que isso se está revisando com muito cuidado para cada país, para ter a melhor solução de enviar as vacunas. Gracias.
Muchas gracias, doctor. Siguiente pregunta es de Trinidad y Tobago. Un segundo. Aquí está, de Gebrick Alvarado, de Newsday en Trinidad y Tobago. Dice que Trinidad es uno de los países más afectados en la actualidad y con poca vacunación, que el país se encuentra en un encierro y estado de emergencia, afectando económicamente a toda la población, y pregunta cuál es la recomendación de la OPS. Doctor Aldigueri.
Thank you. As it's a question from Trinidad and Tobago, I will answer in English. So the public health authorities in Trinidad and Tobago are reporting with a lot of discipline new cases and death to PAHO under the international health regulations. And so we are aware of the assessment of the government of Trinidad and Tobago. As of June 14, the country has reported almost 29,000 cases and 677 deaths. During the COVID-19 pandemic, several large cities and countries have used lockdown measures, public health measures, as it is being used in Trinidad and Tobago currently, in order to decrease the intensity of transmission by limiting the movement of the population. PAHO is aware that these public health measures have an impact on the economy of the countries. However, when strictly implemented and monitored, they are very effective in bending the epidemiological curve and protecting the healthcare facilities for severe and critical patients. While at the moment the acquisition of sufficient vaccine poses a challenge, the country, Trinidad, should continue to vaccinate as many persons as possible. It is important to note that with limited movement for a specified time period, coupled with its continued effort to provide vaccine for its population, Trinidad and Tobago can decrease the level of community transmission with an eventual return to economic activity. I hope I have answered the question from Trinidad and Tobago. Thank you.
Muchas gracias, doctor. Siguiente pregunta de Jacqueline Charles del Miami Herald en inglés. Dice que a survey in Haiti recently found that 75% of responders refused getting a vaccine against COVID if it was within reach, compared to only 9% who would agree to take it without constraint. And she says that understand that PAHO recently conducted its only survey, and is this consistent with your findings, and how do you battle these kinds of hurdles, given that at this stage the government still hasn't started any vaccination campaign, distribution is still unclear, and a lot of PR damage has been done to the principal vaccine that Haiti is supposed to receive? Dr. Barbosa?
Thank you for this question. This is a very important topic, and from the beginning, PAHO is providing technical cooperation to our member states, because to have a good immunization campaign, you need the vaccine for sure. Without vaccine, you can do nothing. But you also need many other activities around the vaccination. And a good communication strategy is one of them, and probably the most crucial one that we have nowadays. Because unfortunately, the vaccine was targeted for many anti-vax groups, people that are sharing rumors, conspiracy theories around the COVID-19 vaccine. So as our director mentioned at the beginning, this is not the main problem that you are facing. Of course, that the countries in our region, they have a long-standing tradition to vaccinate millions of people, but it's very important that the national authorities in each country establish a direct and transparent channel of communication with healthcare workers, with the communities, with the population, showing them the data. It's not the hypothesis. We have data now, data from real life, showing that the vaccines can save lives and can contribute to control this pandemic and to allow countries to recover from the very important impact that their economies are suffering. So we are supporting the Ministry of Health to do that, and of course that through our country office in Haiti, and also from our team here in Washington, we are working with the Haiti Ministry of Health to have a very good communication to show the facts, the evidence to the population and to healthcare workers, to allow and to support and to encourage people to get the vaccines that will save their lives. Thank you.
Gracias, doctor. Ya estamos llegando al final de la sesión del día de hoy. En la siguiente pregunta de Tobias Kauffer, corresponsal para Latinoamérica de Die Welt, dice en inglés: How can countries that have made successful progress in immunization still see high numbers of new infections? Doctora Etienne.
So thanks again for this important question. As we've made the point before, vaccine coverage differs from country to country. So while there are some countries in our region that have yet to protect even 1% of their populations, some countries like the US, Chile, and Uruguay, they have been able to secure and administer vaccines faster than most countries in our region. And what we've learned from reports that in places where COVID vaccination coverage has been high, like in the US, the United Kingdom, and Israel, there has been a dramatic reduction in COVID-related hospitalizations and deaths. And when outbreaks do occur, as we've seen in Chile, COVID vaccines are protecting people from the worst of the virus. If you will recall in my remarks, I did say that the highest groups that we are seeing hospitalizations, it's the 20 to the 40-year-old group, age group. And you will recall that that was not the high priority in all of our countries when we went through the prioritization for vaccination. And this protection is exactly what COVID vaccines were designed to do, to protect our communities and help us save lives. So it is protecting those priority groups that it was first given to. So one of the things that we need to be clear about is that vaccines cannot stop an active outbreak. And COVID outbreaks can still happen even with high vaccine coverages. No country has yet to reach herd immunity. And so more remains to be seen about how we can achieve population-wide protections, particularly as the variants circulate. Let's just remember that vaccines are just one tool in our COVID arsenal. And that is why we've always emphasized the importance of relying on proven public health measures, even as vaccines are rolled out and until we are able to arrive at sufficient coverage for herd immunity. Countries will still need to support testing and contact tracing, isolation, quarantine to limit outbreaks. And people should still have the tools and the support that they need to protect themselves when they are sick and to prevent others from getting infected. And of course, people need to follow the regular measures of wearing masks, on social distancing, and frequent hand washing, etc. And as I said before, ending this pandemic will require leveraging all the tools that we have at our disposal. So let me thank you again for joining this press briefing, and let me wish all of us a safe week. Thank you very much.
Muchas gracias, doctora Etienne. Ahora sí, entonces hemos llegado al final de la sesión de hoy. Recuerden, como siempre, que pueden encontrar más información en la página web de la OPS, incluyendo informes diarios actualizados con los números de la situación epidemiológica en la región, www.paho.org/coronavirus, y también no olviden seguirnos en nuestras redes sociales también para ver más información actualizada de la OPS. Ahora sí, entonces nos despedimos. Muchas gracias nuevamente y sigamos cuidándonos. Saludos.